From University of Deusto, psychology, Neuro-e-Motion team, and the first CTNNB1 PhD that we think ever existed so far. So welcome, Mercè.
Thank you, Anna. Morning, everyone. Before I start my presentation, I would like to thank the CTNNB1 Foundation and the Spanish CTNNB1 Association for giving me the chance to present here today at the 3rd International CTNNB1 Conference. So for today's presentations, I'm going to share with you the 3 articles that make up my doctoral thesis, as Anna said, which are about the clinical, psychological, and neuropsychological characterization of 25 CTNN1 syndrome patients. So, like this. No, I went too far. That's the right slide. So, as you already know, CTNN1 syndrome is a neurodevelopmental disorder caused by a genetic variant, and it's a rare disease due to its low prevalence, and also it was first discovered not so long ago in 2012 by the Light and colleagues. So even though all the CTNN1 syndrome patients share many clinical manifestations like intellectual disability, language delay, autistic features, behavioral problems, among others, there's a great phenotypic and a great genotypic variability among the patients reported so far. And also, even though this phenotype includes many and is related to many cognitive and behavioral aspects, there's only been a few studies that have focused on those topics and that have used standardized methodologies to assess them. So that's why so today's aim is to focus on those aspects. So before I share my results, I would like to also present the team that has been working on these articles. We are a multidisciplinary team that are from different institutions from the Basque Country. So some of us are from Achucarro Centers for Neuroscience, from Biofísica, BioVizcaya, and also from the University of Deusto, from the Neuro-e-Motion research team. And last but not least, the CTNNB1 Spanish Association, la Asociación CTNNB1 Española, who have actively participated, that all the families here have actively participated, and I'm really thankful to them. So the first step of our investigation was to carry out a systematic review of the literature. So we included articles that included CTNN1 syndrome patient, and that at the same time, they talked about cognitive and behavioral aspects into some extent. So the main conclusions were that the symptomatology description of these patients was highly heterogeneous with varying degrees of impairments, but these articles did have many methodology limitations, such as sample size was really small. Also, there was a scarce use of standardized methodologies, so only a few included the specific assessments protocol, and those that did include a specific assessment protocol, the instruments used were unsuitable for CTNNB1 syndrome patients, given that many CTNN1 syndrome patients have motoric problems, visual impairments, and also some of them are nonverbal, and some of those tests do require expressive language, so that could have biased results. So with all of that, we saw the need to carry out psychological and neuropsychological assessments using a comprehensive and a syndrome-specific protocol to characterize the phenotype and of the CTNN1 syndrome. So the second step was to, in fact, create and implement a comprehensive and in-depth protocol to study key aspects of neurodevelopment of CTNN1 syndrome patients, and also focus on clinical and manifestations and psychological manifestations, So here on the screen, you can see the assessment protocol that we use. I'm not gonna go through each test. We assessed 25 Spanish CTNN1 syndrome families, thanks to the collaboration of the CTNN1 Syndrome Spanish Association. So to do that, we asked them to respond questionnaires through the Qualtrics platform. We also conducted online interviews, and we asked the child physiotherapists if they could assess the gross motor functioning measure. So the genetic variants that we found, I'm not going to go into much detail, given that my colleagues here, Caroline, Rafa, and Sonia, will further explain, but here you can see the mutations found in our sample. Also, we wanted to see the main developmental milestones. So the age range at which these most significant milestones were reached really varied across our sample. However, they were delayed for all the cases. Here in this graph, you can see a comparison between the normative mean age, which is the blue line, which kids are supposed to reach those developmental milestones, comparing with the mean age of the CTNNB1 sample that we assessed, which is the red line. So as you can see, it's delayed for all of the significant motor milestones, which are the first ones, and then the three lines are the language developmental milestones. Also, we wanted to see different clinical and psychological manifestations. So regarding pregnancy and newborn period, age at conception was within normal age range. 40% of the mothers assessed experienced problems during pregnancy, and whereas for the newborn period, high frequencies of feeding problems and active problems were provided. We also asked about motor impairment, so 88% of our sample reported spasticity currently or in the past, mainly affecting the legs, 92% hypotonia, mainly affecting the core, and 68% of our sample needed some system to walk. Also, we assessed fine motor skills through the MAX questionnaires, and the mean result indicated that most of our patients could handle objects with some reduced quality and quantity, whereas for the gross motor functioning measured, we did find a wide variety of the results. We also assessed adaptive functioning through the Vineland-3, and none of our participants obtained a normative score. Also, the least affected dominant was communication, followed by socialization, and the most affected one was the daily living skills domain. And we also find high frequencies of behavioral problems, both internalizing and externalizing. And for ASD symptoms, we assess with the social communication questionnaire and the child's autism rating scale. So more than half of our sample obtained scores above the cutoff score, so indicating ASD symptoms. We also assessed, we also wanted to see the language abilities. So 32% of our sample were verbal, 32% also were nonverbal, and used signs or pictograms to communicate, and the 30% remaining used both systems to communicate. However, the ones that were verbal, most of them had articulation problems. And another finding that we wanted to check was if there were differences between the performance of expressive and receptive domains. So here in this graph, what you can see is the raw score of each participant. So the yellow dot is the receptive raw score for each participant, and the green square is the expressive raw score. So we also carried out introsubject analysis, and we couldn't find statistical differences. And to finish with the main conclusions of this article was that basically we wanted to highlight the importance of sphincter control because it was a variable that correlated with many other clinical variables. So this is the first study to suggest this finding for CTNNB1 syndrome literature. However, this has been reported in many other neurodevelopmental analogous disease, saying that sphincter control is a strong predictor for cognitive functioning and adaptive skills. Also, age did not correlate with any clinical manifestations, but age at which each milestone was reached did correlate with current better performance. Therefore, this finding suggests that if a child reaches within a normal age range a developmental milestone, they have current better performance compared if that child reaches that developmental milestone later in life. Also, we could not find statistical differences when comparing expressive and receptive performances. And we also did not find none of our participants scored within a normative score for adaptive functioning. And we also found high frequencies for severe behavioral problems and ASD symptoms. Moving forward to the third and last step of our investigation, our aim was to compare the cognitive and adaptive functioning of CTNNB1 syndrome patients to analogous disorders such as ASD or CP, given that those are two neurodevelopmental syndromes that share many clinical manifestations with CTNNB1 syndrome. And as you already know, many of our kids are previously diagnosed with one of those conditions, given the only effective way to diagnose our syndrome is through genetic testing. So we wanted to see if we could find any differences. That's a protocol that we used. And for that, we assessed 55 pediatric patients, 25 of them were the Spanish CTNNB1 syndrome patients, and we also included 2 control analogous groups. So we included 17 children with autism and 13 with cerebral palsy. We collaborated with the Spanish Association, so we traveled across the country during family meetings to do in-person cognitive assessments, and we also collaborated with Abnavi Autismo Vizcaya and Aspace Vizcaya. And we also conducted online interviews with the parents for the adaptive functioning measure. So concerning the neuropsychological profile, we could not find differences in verbal related tasks. However, we did find significant differences for the non-verbal tasks. So here on the screen, you can see on the 3 tests that we did find differences. So the matrices, object assembly, and recognition, which are 3 tests from the non-verbal Wessler scale. So as you can see here, the CTNNB1 syndrome group performed significantly worse compared to the CP group and the ASD group for the 3 tests that all of them require visuospatial and logical thinking tasks. And regarding the adaptive functioning, we could not find main differences. So we did not find differences with the total score of the Bineland-3 and neither for the 3 main domains. So we did not find differences in the communication, socialization, or daily living skills domain. However, we did find specific differences when comparing groups. So when comparing CTNNB1 syndrome versus ASD kids, we did see that ASD kids perform significantly better for most subdomains. However, we did not find differences for the verbal subdomains, suggesting that both conditions have an heterogeneous language profile. And also we did not find differences for most socialization subdomains, also suggesting that both conditions may have social interaction problems. And whereas when comparing the CTNNB1 syndrome group versus the CP, we did not find differences in areas where motor functioning was crucial. However, we did find differences in those areas where cognitive skills and appropriate behavior were required. So the main conclusions of these articles were basically that this is the first study to compare the cognitive and adaptive functioning of CTNNB1 syndrome patients, and at the same time, to compare those results with analogous syndromes. So we could not find differences in verbal-related tasks. However, we did find that CTNNB1 syndrome patients perform worse in logical and visuospatial-related tasks. That suggests that CTNNB1 syndrome patients may show stronger verbal performances compared to nonverbal tasks. And we could not find main differences regarding adaptive functioning. So to finish with my presentation, I would like to briefly highlight the following ideas. So there's still limited information regarding the phenotypic profile of CTNNB1 syndrome patients. However, here we have created and implemented a comprehensive assessment protocol to assess cognitive, behavioral, clinical, and adaptive functioning. Also, we saw high frequencies of maladaptive behaviors and ASD symptoms that appear to significantly affect the quality of life of the kid and the families and the functioning of the whole family. So more studies should focus on those aspects, also to create targeted intervention therapies. And also we saw that developmental milestones were often reached well beyond the normal chronological age. So that means that maybe when a child is not longer expected to walk, he can start walking. So that leads to the importance of receiving an early intervention therapy to support the optimal development, all of those aspects. And also we saw that cognitive verbal task performance was comparable to control groups. However, the CTNNB1 syndrome group performed significantly worse on visuospatial and logical thinking tasks. So with all of these ideas, we saw the need, and I wanted to highlight the need for longitudinal studies to clarify the clinical profile of the syndrome, like the NHS study that we're currently working on, which will teach us many things about CTNNB1 syndrome that we don't know already. So thank you very much. And if you have any questions, I'll be happy to share them.